Human services is really about the practice of helping people, improving their quality of life, and ideally helping them address anything that's getting in the way of that quality of life.
So people who enter to pursue a degree in human services are doing that because they want to at some point be able to help other people as a counselor, as a clinician, as a caseworker.
It's not uncommon for people with backgrounds in human services to work in the medical field, in hospitals, in behavioral health, working with individuals with both mental health and substance use disorder issues. You also may see individuals with human service backgrounds in the criminal justice system, working with probation or social services like DCFS.
We have several different options. The most popular option is the Associates in Applied Sciences, or the AAS degree. We happen to have an accreditation from the Illinois Certification Board as a substance abuse counselor training program.
There are not many schools that provide the accredited program for the CADC, which is Certified Alcohol and Drug Counselor certification. And this school does, so I was recommended to come here.
We also have some students who come to us, they've already completed their degree in human services before they got here, so they take a smaller number of courses to obtain their CADC in what we call our post-baccalaureate program. So 3 different options, but ultimately they all help prepare you to enter the field of human services.
I was glad I came here because of how supportive the staff have been of me, and they've really helped me through. And like I said, I've been through some really bad times since I've been in school, but always stayed on top of my schoolwork because I always had teachers and the instructors kind of backing me and the counselors helping me as well, just to make sure, pretty much to make sure you succeed.
We have smaller classes. We really have a lot of contact between students and the instructor. Part of the benefit of having smaller classes is that we really can create a pretty comfortable learning environment. We know that coming back to school can be challenging. We also know that at times people can feel intimidated when they're in large classrooms and really in a personal environment. You won't have that here at Bonzi. You really get to know your instructor and your classmates very well. We also then integrate some realistic learning experiences into the classroom. So we will talk about things like assessment and diagnosis, but we use case studies, we use in-class activities, we use in-class experiential activities to let people do that in class. We really try to keep it a small, comfortable environment to really emphasize the relationship between the instructors and the students, and between the students and each other.
I think Waubonsie does 2 things very, very well, which sets them apart from other academic institutions. One of those is collaboration. The staff at Waubonsie philosophically very much are in line with what I would consider best practices or evidence-based practices, cutting edge in terms of being ahead of or understanding the research. And so the students we get are more than ready to tackle the challenges in front of them in working with clients with mental health and substance use disorders. I think Waubonsie is really, top notch when it comes to bringing students into the field that are prepared to do what is required of them to be successful in these jobs.